show you what I think is going on.
Mm-hmm.
So when we talk about the knee, think about it like a hinge joint.
Mm-hmm.
We'll go to your left knee. And so when I show you a hinge joint, it's like back and forth, right? It flexes and it extends. It also does a little of this corkscrew movement, like a screwdriver. That's why we call it the corkscrew. I tested the inside of the ligaments, the outside. I tested. I'm gonna show you. I'm gonna show you on this one. I tested not only the inside and the outside of the ligaments, but I even tested the PCL and a little deeper the ACL, which tells me all your ligaments are intact. That means everything is stable. So I'm not worried about your knee buckling, even though that's kind of one of your concerns, is like it feels like it's going to give out. What I think is happening is a condition called Chondromalacia patella. I've seen it in some people where it resolves very quickly. I've seen it resolve most of the time. I would say 9 times out of 10, it does take some effort. What the heck is Chondromalacia patella? So here's the patella, or the kneecap, and you hit the nail right on the head when you said, I think it's under the kneecap, and that's where. So what happens is that the kneecap is really unique in that it's like, it creates an extra lever, however you want to call it. And so the quadricep tendons kind of come across here, and this kneecap helps provide that attachment point right to the front of here. So that extra kneecap not only helps mechanically create extra levers, or meaning like, so let's just say this can only contract 10 pounds. It makes it feel like the knee's moving like 20 pounds, right? I don't know, I'm coming up with random numbers. But that's kind of like how the kneecap works. It helps control some of the movement that occurs within the knee joint, and it allows the quad to work more efficiently. When this patella, now if you look at it like this, from this perspective, there's this space in here, right? This space is supposed to stay like a space. On the back side of it, right here, there's a little bit of cartilage. There's a little bit of cartilage there, and then there should be that space in between. Sometimes, and this might be what's happening, is that space gets a little bit more narrow, or the kneecap starts to go a little closer, and what that can do is grind down some of the cartilage. I don't think that's severe on you, but when I pushed directly into your kneecap going this way, and I did what we call a patellar grind test, that's the only thing that can create some issue. I think when you're feeling the pain on these sides here, that's what we call referred pain. I don't think it's true pain. I guess by a definition it is true pain. But I don't think it's true referred pain, true pain that's actually caused from the joint space. I think it's actually from the patella grinding. There should be a good amount of knee mobilizations and stuff like that, and you got to be very careful with your rehab and stretching protocols, which we'll have to talk about. And like, I'm gonna definitely prescribe some self massage that you can do on yourself, and I'm gonna show you like a video that I have on that. But I definitely think you should do that at least twice a week. Trying to do that, and if you're not feeling results, then maybe we have to do some more sports therapy on you. I think you should be okay, but you don't want to really strain the kneecap right now. That's why I asked if you fell on it and stuff like that in the beginning. This is good news for the most part for your age and your activity level, but again, I've seen people who are older than you and it not recover despite doing all the proper protocols and therapy, and I've seen people like just randomly heal on their own. If it's not healed in 1 year, which it hasn't, we gotta ask these questions. And we gotta say, like, is it going to heal at this point in time on its own? Probably not, statistically speaking, right? But that doesn't mean you can't help yourself, and it doesn't mean you need to come in here more. It just means, let's try maybe some self-massage for the next 2 weeks, and if it's still not better, then we, maybe 3 times. Let's just say you get 6 sessions of your own self-massage, and I'll show you how to do it, and do that for the next, 6 visits or 6 weeks on your own, And then if it's not getting better, then we kind of talk about more of a plan. But most of the time, self-massage really helps, and not overloading the knee. So if you're going to run 30 minutes, maybe you run 15 minutes or 20 minutes, because you don't want that knee to start grinding up.
Yeah.
The last thing you want to do is take this kneecap and like kind of shave down some of that cartilage a little bit, or shave down, because let's be honest, this is like one of those conditions where like you don't get that space back. You don't. And people don't realize how important the kneecap really is. They really don't. Like, for you to be able to do this nice and evenly, it's because of your kneecap, not because of anything else. So does that answer your question?
Yeah.
I think it's a very mild form, because I really had to push heavily on your knee, and then I had to tell you push your knee into the ground. Whereas some people, I could just go like this, and they're like, "Ow!"
Yeah.
And then they're like, "Oh my god!" And then like they'll light up heavily. This is a tough condition to deal with sometimes. I don't want to sound like bearer of bad news, just because they linger around a while.
Yeah.
You already knew that because you had this.
I mean, it's been kind of like an on and off thing, and it's been so progressive and so mild that I wasn't too worried about it.
Yeah, so that's why I would recommend, and that's why I asked about your exercise program. Are you running? What are you doing? I think if you kind of hold off a little bit on the running, and you do more full body planks and side planks, and like if you're gonna go gardening, for example, you're wearing knee pads. Like if you're gonna be doing work on a bicycle, for example, and you're working on the chain and you're crouched on a knee, you want to have a towel or a knee pad under there. You want to make sure you protect that impact that drives that knee into the femur, like something like that. So try not to fall on the knee too, obviously. But I would highly recommend strengthening the hamstrings though.
Okay.
Definitely strengthen the hamstrings a little bit. That shouldn't cause problems. Sometimes just over strengthening the quads actually creates more of an issue than strengthening because it irritates the patella more so than it. So I would recommend strengthening the hips and the pelvis and the hamstrings, and not as much emphasis on here right now. More just like soothe this thing, cause the pain to go from a 3 to a 2, hopefully, and then a 2 to a 1, and then maybe we can start adding that in. I don't think strengthening the quads is out of the picture for you. I do think that just like, let's do the opposite right now. Let's just calm the front of it, do some self-massage, strengthen a little bit of the hamstring. I wouldn't do both right now. Just see what works for like a month first or 2 weeks first. Just do self-massage first. Then after about 2 weeks, then you could really start focusing heavily a little bit more on strength training program. And just because if self-massage makes it worse, then maybe we just leave it alone and just start strengthening the hamstring. If you do 2 protocols at once, how do you know which one's working? What if you're wasting your time strengthening when all you need to do is massage? What if the opposite is true? I don't want to waste your time. You don't want to waste your own time. Why spend 20 minutes a week? However, I will tell you, at some point in time, you're going to have to strengthen. I just want to know which one's your best, like which one will kick the ball further ahead faster. Is it going to be 2 weeks of mobilizations? Or is it going to be 2 weeks of strengthening? And you'll find that out after 2 weeks. You will definitely know. If you already feel after 2 weeks that massage is already feeling better, don't even worry about strengthening right away. Just do another week or so, and then you can always give me a call and be like, hey, do you think I'm ready for strengthening? I'll upload something to your app or something and do that. The thing that I will upload to you is a little bit too long on the app, so I'll have to send you a private YouTube link for that. Okay. Any other questions on that?
No, thank you.